Hi, I'm Dr. Noel Alpins from Melbourne, Australia, and what I'm talking about today are the calculators that I've made available to ISRS members for free to be able to use on the ISRS website to help them in preparation for papers or presentations and meetings, to be able to analyse all their astigmatic data, whether they want to do an analysis by refraction, an analysis by topographic astigmatism, or even for toric implants. It's very useful to be able to do an analysis so you can work out whether the astigmatism is overcorrected or undercorrected, whether it's on axis or off axis, and how successful it's been using the difference vector. So there's an unlimited number of patients you can put in, and it's very easy to use. The group analysis calculator can do hundreds or thousands of patients if you're into big data, and it's very useful for being able to present the information in a scientific format that is acceptable for the journals and for scientific meetings. The toric calculator is for people who use toric implants. It's very accurate, it has every parameter covered, especially effective lens position and all the other important parameters. It's useful for any implant that you use, any toric implant. It's got every implant listed, so the real advantage of it is that you can be shown the spherocylindrical target according to your patient individually and that implant. So if you like 2 or 3 different toric implants, you can choose the one that's got the one that's closest to zero target. The toric surprise calculator is very good also because it tells you how much you might need to rotate an implant if there's a refractive cylinder left over, but also gives you a vector analysis of the answer to see whether the implant was actually overpowered or underpowered, or whether the implant was the correction index on that implant for the amount of corneal astigmatism. And I think the most important 2 calculators I find that I think you will find very useful for every patient you do laser surgery for, and that's the ORA, or ocular residual astigmatism calculator. It tells you when there's a difference between the corneal and the refractive cylinder, how big that difference is in vectorial terms. So if the ORA is greater than 1, which happens in somewhere between 30 to 45% of patients, then that's a red flag that this patient might get an adverse outcome or less than excellent outcome. They should know this in advance, even if you don't use vector planning, so you can give the patient a little bit of a warning. But then if you decide I'm going to use vector planning for this patient, you can use vector planning for every patient from now on. By the ORA calculator then converts into the vector planning calculator and tells you what the spherico-cylindrical treatment is for this patient by bringing the corneal topography into the plan in association with the refraction. So at the end of the day, you end up with less corneal astigmatism for the patient, sometimes the same, if not less, refractive cylinder, and better visual outcomes, less glare and halos, and happier patients. So I hope you find all these calculators useful in your day-to-day practice. Thank you.